Hello viewers, welcome to the Learners Nursing classes. I will be dealing with the basic nursing multiple choice questions. So let us not delay and start. To prevent the tongue falling back, the safest position is lateral. Valuable items of the patient like money, jewelry, belongings to be sent to the office of the administrator. After surgery, the patient should void urine within 8 to 10 hours. But I also want to tell you, in case of major surgery or a bypass surgery, the patient will have indwelling catheter. In major surgery, the urine output should be 0.5 ml per kg body weight per hour, and bypass 1 ml per kg body weight per hour. That means if the patient's body weight is 50 kg, the patient should have urine output of 50 ml per hour. In case of general anesthesia, total intravenous anesthesia, nerve blocks and spinal anesthesia, patient should be passing urine in 8 to 10 hours. Otherwise, it is an alarming sign. It guards at about the cardiac output of the patient and the renal function of the patient. The bandage that is applied on the head is called as Kaplan bandage. That is, spica is a shoulder bandage, spiral is a wrist bandage, and circular is circumferential bandage. So the answer is Kaplan bandage. The stiffening of the body after death is rigor mortis. It is the stiffening of the muscle due to chemical changes in the myofibrils. It is also indicative of the in post-mortem, where we can identify how long it has been a person is dead. I also want to tell you what is the definition of the contracture. So hardening and shortening of the muscle tendon leading to the deformity and rigidity in the joints is called as contracture. Whereas keloids, a raised scar after an injury has healed, is keloid. Now, difficulties in the expression is the communication barrier of. So before solving this, I want to tell you what a communication is. So communication is the exchange of information by speaking, writing, or using some medium like WhatsApp or emoji or expressions. So in this, the difficulty in expression is the communication barrier of physiological. The answer is physiological. Neglected mouth care can cause all except the conjunctivitis, because conjunctiva is present in eyes, and inflammation of conjunctiva is called as conjunctivitis. Gingivitis is the inflammation of gums. Parotitis is the inflammation of parotid. Glossitis is the inflammation of the tongue. Emotional disturbances is the communication barrier of psychological. One of the major health problem in India is, it's very common, tuberculosis. Now the National Tuberculosis Elimination Program, which is going on right now, previously known as the revised National Tuberculosis Control Program, to reduce the tuberculosis burden by 2025. That is a 5 years ahead of the Sustainable Developmental Goals. So the answer is tuberculosis. Invisibility is the communication barrier of environment. So what is invisibility? Distorted messages, because the sender and the receiver cannot physically see each other. So the answer is environmental. The act of feeling with the finger or hand is termed as, the answer is palpation, like we are palpating the abdomen and we are palpating the gravid abdomen for the assessment of the gestational weeks. So I also want to tell you what is inspection. Inspection is the act of looking at something. And what is percussion? Striking one solid object over the other against the other and with some force, like striking one finger over the other, keeping it on the chest. So that is called as percussion. Now what is auscultation? Listening to the sounds with the help of stethoscope is called as percussion, like heart sound, lung sounds, fetus heart rate, and all that. Now anorexia denotes to the loss of appetite, but we should also know what is the loss of sleep, insomnia. What is the loss? What is the excess hunger? Polyphagia. Excess thirst? Polydipsia. Now, for effective communication, feedback is a very essential component. The most important component is feedback. Sharp instruments are sterilized by the immersing it into disinfectant or the chemical sterilant. Name of the nursing leader, Fabiola is the known nursing leader. Best health education aid is stimulant to the all senses. Inflammation of the parotid gland is called parotitis. Stomatitis is the inflammation of the mucous membrane of the mouth. In emergency situation, circulation, airway and breathing, all above. We have to maintain all above. In the pattern of circulation, then airway and then breathing. Formulation of goal and nursing intervention is the process is planning. Abnormally elevated heart rate is called as tachycardia. When the heart rate is more than 100, it is called as tachycardia. In case of the fracture, the first aid is immobilize with the help of the splint. Dark red blood color is seen in. Now before telling you the answer, I want to tell you what artery is. Blood vessel carry oxygen rich blood to the entire body is called artery. Arterioles are the small blood vessels that carry blood connecting the arteries and the capillaries are arterioles. Capillaries are the fine branches blood vessels that forms network between the arterioles and the venules. And veins are the blood vessels that carry oxygen poor blood returning to the heart. So here the darker red color blood will be seen in the venous bleed. Discontinuity of the bone is called as fracture. So I also want to tell you what is dislocation. The joint is forced out of the normal position is called as dislocation, like shoulder joint dislocation, hip joint dislocation. And sprain is the stretching or the tearing of the ligament. Strain is the stretching and the tearing of the muscles. Now hand washing is the best way to prevent the cross infection is a very simple answer. Type of bandage used in scrotal dressing in position is, answer is T bandage. All the scrotal cases or the rectal cases, the bandage used will be T bandage. The level of knowledge is the communication barrier of cultural. Water is lost from the body through all above. All above. Answer is all above. Perspiration, that is sweating. Expiration means breathing out. We breathe out vapors also. Urine and feces, everybody knows. Answer is all above. Sudden return of the body temperature to the normal is called as crisis. Now I want to tell you what is a crisis. Crisis is the onset of sweating. It is due to the central thermoregulatory failure and this is called as crisis. What is lysis? Is rupture of the cell membrane resulting in the removal of the cell content and death of the cell is called as lysis. Pyrexia is the body temperature going above 100.4 degree Fahrenheit, that is called as pyrexia. Administering the medication in the body cavity is called as instillation. Insufflation is the putting gas inside. Infusion is putting IV fluids inside, and instillation is putting some drug or medicine inside the body cavity. Infusion is always into intravenous, and inhalation is like steam inhalation. Medication technique, administering fluid and admission. Stomach wash is known as gastric lavage, and when we give stomach wash with saline or water, it is called as stomach wash. Gavage means feeding technique. Using a tube directly into the stomach is called as gastric gavage. Like in case of newborns, we give gastric gavage feeding. Irrigation is using controlled amount of fluid to dilute the field is called as irrigation. So here the answer is stomach wash is known as gastric lavage. Thank you so much, viewers. That's all for now. I'll be coming up with many more videos. Like, subscribe and share. Bye bye.